So we would think about prescribing you azathioprine, usually in the context of either Crohn's disease or ulcerative colitis that keeps on flaring up. So we initially tend to use rather simpler treatments, mesalazine or steroid therapy, but where the disease continues to flare despite recurrent courses of those treatments, then we need to think about something else. And that's where certainly we would think about azathioprine for you, just to help keep a lid on symptoms and to keep you well.
Whenever any patient has been prescribed azathioprine or mercaptopurine, there'll be an appointment made to see myself in the pharmacist clinic or one of the specialist nurses to chat through the drug in more detail. Initially, when patients start, there's always some apprehension. Visiting me is all about ensuring that I put their mind at ease, and we have very, very positive outcomes with patients who start the medication. It's all about ensuring that we can reduce the frequency of them needing a steroid. And to ensure that we can maintain their disease control, reducing their need to potentially be on another steroid in the future.
The reality is that both azathioprine and mercaptopurine can cause side effects in about 15 or 20% of people. So in other words, the majority of people who take these treatments are fine on them and they don't cause any problems. The common symptoms that you might expect to run into, well, they include a variety of things. They might be headaches, they might be feeling nauseated or sick, they might include tummy pains, and then there are other significant issues for which we undertake regular blood test monitoring. Now, the blood testing, just to touch on that briefly, initially we tend to check blood tests every 2 weeks once we've initiated you on treatment. That continues for a couple of months, and we then gradually space out those blood testing regimens. And those are testing you particularly for evidence of liver inflammation and keeping a close eye on your blood count as well, just to make sure we're not over-immunosuppressing you. We or your GP will look at the results of those blood tests, and if there are any problems on those, we'll come back to you and make some suggestions as to how to adjust your drug treatments. In addition to these somewhat common side effects, there are also some rarer problems that you can run into, which are potentially more serious and which understandably people find slightly scary. Pancreatitis or inflammation in the pancreas causes really nasty abdominal pain spreading through to the back and feeling very unwell with it. And if you were to develop this problem, typically 3 weeks or so after starting treatment, then you should present to your doctor or to the local emergency department for them to assess you. Skin cancer, of course, we're all at risk of, slightly increased risk in people taking azathioprine or mercaptopurine, and you can reduce this risk substantially by just being careful about sun exposure and wearing sun protectant. Relating to the lymphoma risk, again, this seems very scary, but thankfully the risk of this, the absolute risk of this, remains very low. And that's illustrated on these slides, which show you 10,000 people, the baseline risk of lymphoma in people who have Crohn's and who aren't on treatment, and then the effect of taking azathioprine or mercaptopurine in increasing this risk. And although the risk is up a little bit, the absolute risk remains thankfully very low, and placed in context, for example, much, much lower than the risk of dying in a car crash, for example. So I hope you'll find these slides reassuring, but at the same time helping you to understand what some of the potential risks at least are of treatment.
I was diagnosed with severe Crohn's disease in 2014, and I was put onto azathioprine at quite a high dosage. It took about 3 months to get into my body, and after that period I started noticing the effects of it. I did notice I was catching colds more easily. However, I wasn't feeling as tired and I wasn't as skinny as I was previously. However, as my white blood cell count had dropped, I had to have regular blood tests to check my blood levels were okay, and with that they changed my drug dosage, which was really easy because they just changed the amount of pills I take each night. There's quite a lot of different side effects to it, and it's just being aware of them and making sure you know what could happen, but they don't really affect me too much. Genuinely, it's improved my life significantly before I started taking the drug.
You really need to weigh up the risks and benefits of these treatments, and that's very much what we do as doctors and prescribers and nurses for these therapies. So yes, the side effects of treatment look scary, but don't underestimate the potential side effects either of recurrent courses of steroid therapy or actually just of ongoing inflammation within the gut with all of the associated symptoms with that. And we're very confident that these treatments will help you to get better and to restore you to health, essentially.